Hi, my name is Brandon Klump. I'm the clinical director here at the Foot, Ankle, and Running Center. Today I have Kayla with me. She's going to be helping us out as we're going to demonstrate myofascial decompression, also known as cupping, and kind of go over the benefits of that treatment. So today what we're going to do is we're going to treat lower extremity kind of posterior chain, so hamstrings, calves, gastrocsoleus complex. We're going to try to demonstrate what this technique is and kind of how it looks. The goal of it is to just increase the soft tissue mobility. We know when athletes move, restriction can develop between the different muscles, tendons, nerves, and what that can do is impede motion. What we're trying to do is separate those things to get more of a fluid motion and decrease that resistance to movement. So for her, we're going to start with some of the bigger ones because we're going to work up into the posterior thigh, hamstring. So you kind of move it around, you get it connected, and then you pull some of the air out. So you see that's pretty firm. It kind of draws the skin and soft tissue up. If you have somebody that especially has kind of some inflammatory response going on, maybe a more subacute injury, we see within session big changes in tissue mobility, big decreases in pain. And this is kind of the type of treatment that you should see a pretty quick turnaround on the response. It's not one of those ones where you do it and 2 days later you find out how things went. You get pretty immediate feedback because you're mobilizing and loosening up that soft tissue and kind of decreasing those restrictions right within the session you're working on. And I'm just giving you a quick example of what we might do. You can actually see all the tissue tension is picked up right in between here. You're getting a little bit of discoloration as well as a little bit of discoloration underneath the cups. What that's doing is that's pooling blood flow. It's increasing blood flow to the area. I find doing some mobilization work or some massage afterwards really helps minimize any potential bruising that you could get. So I'm actually really surprised right now because I thought for sure with as much as Kayla runs that we'd get a lot in her hamstrings. I thought we'd get a lot of restriction or even some kind of popping or some release, but right now everything seems pretty good.